Okay, welcome back. And then, so that was introduction into research. So then we will talk about writing a research proposal, and then when the appropriate time comes, I will talk about a little bit about statistics and research method, which is epidemiology. So this is what we discussed. One thing is in another 2 days, if we can basically talk a little bit about one day in statistics, the other day research methods, that will be good, but it all depends on how many of you are interested and how many can come. Second thing is, before and or after that, you should, because this shouldn't be a lecture, this should be kind of a hands-on training. No? So today you can't do any hands-on training, but next day, if you are going to have, everyone should bring their research proposal, do a, I mean, not the total one, but and do a kind of a 15-minute presentation, and then we can discuss basically about your problems, your topic, your objectives, that kind of thing, or not only me, but the whole class. And then by the end of the thing, you will have a kind of a skeleton of a research proposal, which will be easier for you to expand to the actual proposal than before, right? And then after that, each research proposal can be individually held. That's a different issue. But the issue is, now if we go today, just listen to the lecture, and like Lanka said, a lot of family medicine people have already submitted their proposals. So I hope I'll be able to basically discuss or tell you the problems you had, answers to the problem. Definitely you would have had a lot of problems, and most probably if you are married, wanted to kill your spouses also while writing this, because Karadaran, as medical people, we are not taught how to write research proposal. We are taught to by heart and vomit and pass exams. We are experts on that. We can do it at any time. Writing research proposal, no, we can't. Big trouble. Then you always try to postpone that and do some other thing. Because so when you are writing, you don't know, then people come and say objective, specific, general. So that's a different issue. So we will try to talk about that. And the issue is, no point in talking about it if we are as a group not doing it. So already you have submitted, that is okay. We can look at that proposal or develop another proposal, but we should get together. Other Q&A come and present because they have nothing to present more probably, but next day then we can have a proposal. But remember, the literature review is your first paper if you have not yet published. So people who have submitted their thesis or research proposals, go back, get the research literature review part, look at it, whether you can submit. And if you don't think there is not enough data, redo the literature review. Right? The literature review, you have objective, why you are doing, right? Your methodology will be what you did, what keywords you use, where you search, then how many articles came from those articles, how you selected the articles that you included in the review, and then your research will be summary of your included articles. Conclusion is what you come out of it. That is the review article. AK meta-analysis, that's more detailed, but each review doesn't need meta-analysis. Right? So, for an example, CKDU, big problem, no, everyone is jumping around, lot of funds. There was a review done a little bit back. So basically, you can now go, if you are interested in CKDU, look for all the articles published in Sri Lanka on CKDU. Write a summary, that is your review on CKDU. Similarly, any other back pain, headache, or myocardial infarction, stroke, anything, if you do a review for all the articles published in Sri Lanka, that will be, summary will be, so you can go to the home and start writing articles. This is what research is not very serious. Then, so we'll go back to this talk. This is something I thought we should remember. This is something I found when we were at home. Can you remember that interesting time where we were at home for 2 months and we suddenly went back from 2000s to 1980s because 1980 වල එළවලු රොඩියක් ගෙදරට ආවා, කැම ටිකක් ගෙදරට ආවා, කිරිත් ගෙදරට ආවා. So you went and gave money and ate, and everyone started knowing who were the family members after a long time meeting them, that kind of thing. So this is basically things that were said. Now remember, planet Earth is a sick planet. We have basically, humans have destroyed, this is not my opinion, this is environmental people, destroyed the planet. A sick planet will breed sickness. Although COVID came after 100 years, other things will come in the near future because planet is sick. So be prepared for other infectious diseases. Actually, COVID was down, but between Spanish flu and COVID, we had about 5 H1N1 Nava, which was Ebola. Then there was another one about a few years back. There were 4 or 5 epidemics, but it didn't become a pandemic. COVID became a pandemic. Now we are having post-COVID pandemic because a lot of people are, again, publications are coming, don't believe me, go and read. There is post-COVID syndrome. A lot of people are trying to link this with Pfizer. How true that I don't know. But there is definitely post-COVID syndrome. A lot of people are suffering. Now articles are coming. Right? So all the people, I also unfortunately got one Pfizer. Because third one I had to take. First 2 I got Sinopharm. So we shouldn't go for that because I'm not a vaccine person, but this is about COVID. So this is what is it. Mask is better than ventilator. Home is better than ICU. Prevention is better than cure. So definitely this, again, the prevention and is better than cure became very, very important during COVID because there was no treatment. Now the issue is we are not very interested in cure prevention because we know that you can cure a lot of things. So yeah, we don't take that much prevention. You know, in Sri Lanka, for the past 30 years, the leading cause of hospital deaths have been myocardial infarction, 2 stroke, 3 cancer, all 3 NCDs. So we don't have an NCD prevention strategy for the country. We are still talking about infectious disease prevention, right? Surveillance systems, we still don't have a surveillance system for NCDs. Majority of us will die from a NCD, not an infectious disease. So that's a different issue. This is basically, and this is again the mask and non-mask things that were circulating at that time. Still, some people are wearing a smart mask. Actually, mask was useful, not always and every place, but it was definitely useful. Even now, if you have a disease, it can be prevented by using a mask and then getting also. And this is basically, again, what happened during time. Another definition for research is formed by 2 words, namely re, a prefix meaning do it again, and the noun search meaning to investigate or look for. Definition of research, another definition, it's a systematic process of criteria in critical inquiry leading to a valid proposition and conclusion that are common to others. And it can be defined as a studious inquiry or examination, especially investigation or experimentation aimed at the discovery and interpretation of facts, revision of accepted theories or laws in the light of new facts. So always things change. Now, Western medicine doesn't know anything. Until recently, you have to fast to see whether you have diabetes or lipids. Now they have started having non-fasting, HbA1c and lipid profile. Saying triglyceride is the only one that basically is affected by fasting. So what I think is when things change so regularly, we don't know anything. හරි තව ටික කාලෙකින් මට හිතෙනවා කෑ මේ ඔක්කොම බොරු එහෙම එකක් වෙන්නේ නැහැ. You don't die also කියලා because lot of things are changing now. Lot of people prevention strategies are very interesting. ටික කාලෙකින් කෑ smoking අපරාධ නෙමෙයි. Smoking කරගෙන ඉන්න තව ටිකක් කාලෙ ජීවත් වෙන්න පුළුවන් කියලා because I don't know. Right? Now I call a lot of people saying පොඩ්ඩක් බිව්වට කමක් නැහැ. ගොඩක් බොන්න එපා. කන්න ඉස්සෙල්ලා බිව්වොත් කමක් නැහැ. So I don't know who's telling because all these epidemiological studies are not done everywhere, only for groups of people. And they are generalizable ability, I don't know, experimental again, I mean. So therefore things change. But the only issue is, unfortunately, I'm a public health person. In Sri Lanka, the public health messages have not gone to the community to the same extent as in other countries, because now I live in Kandy, Kandy Bavak, where you can run. Usually Suddhas run, we laugh at them. Because they know even coming to visit Sri Lanka, that exercise is good. Why? We laugh at them. They are but they still run. And they basically have a nice figure. So I don't know. And a lot of people remember are vegetarians in those countries, not because they are Buddhists or anything, but because colon cancer can be prevented by not eating meat. So this message has gone there. And they are vegetarians because this Sri Lanka male cancer is colon cancer, females I think breast cancer. So this is again because those messages have gone. And we skip that. This also we did. And this is what we are going to discuss. So that Lanka said, a lot of family medicine people have already basically submitted their proposals. So we can.
The junior class is great, but tier 3 they have good single detail.
It doesn't matter, but the issue is it is nice if you have a kind of example, actual thing which we can discuss, because a lot of people have problems when we are writing. What to write in the introduction, and what is the difference between the introduction and the literature review? What are objectives and what are the specific objectives? Then methodology, what should come. But remember one thing, this is a logical process. Everything is linked to the other. The biggest problem comes when we are writing is if we doesn't link things to each other, then problems start coming. So for an example, your topic is generally your general objective, right? And the general objective is usually not achievable because it's a sentence. How the general objective become achievable is by achieving specific objectives. So the specific objectives is you cutting the general objective into smaller achievable sentences or objectives. And because the specific objectives should or can be achieved, there shouldn't be vague terms. So all things have to be action verbs. Determine, cost, calculate, estimate, assess wageva back. How do you assess? No one knows, right? And remember, because you are cutting the general objective into pieces, anything that is not there in the general objective can't be in the specific objective. And because specific objectives, when you get the general objective, everything in the objective should be in the specific objective first. Right? So when you look at it, very easy, make a sentence then your methodology is basically achieving your what? General the specific. Specific because general you can't achieve. It is specific achieve karna ke liye methodology ke liye. How does you tell the reviewer, supervisor or anyone that this is how you are going to achieve the specific objective. How? If there is a data collection tool, questionnaire के कहना make question 5, I am going to achieve the first specific object. ඉතින් ඒක කිව්වම review also knows, supervisor knows, you also know. මොකද ඔයා දැන් ලොක්කා වගේ ලියලා කරන්න ගියාම ඔයා දන්නේ what are you going to do. Then your questionnaire, what is the questionnaire going to do? Achieve the specific objective. එතකොට questionnaire එකේ තියෙන බෑ specific objective achieve කරන්න ඕනේ නැති data collection. Right? And because you are linked each question to a specific objective, right? Any question that is not linked to a specific objective should be deleted because that is shouldn't be there. And also any question that basically should be there for the specific objective. If it is not in the questionnaire, you are in. එතකොට දැන් literature review කොහෙටද දෙන්නේ? Because introduction you tell why I am going to do. That is only. එතකොට ඔයා මොකක් හරි කරනවා නම් what should you do the first? One, yes. Other things, why should you study a subject? Should it be a problem or no problem? Problem ඉස්සෙල්ලාම සෙන්ඩර් මේක මාර problem එකක්. either මිනිස්සු get killed or a lot of money is lost or a lot of අකරි කරදරයක් කාටරි වෙනවා කියන එක තමයි your justification for telling this is a problem. ඒතර ඕන එකක් පටන් ගන්නවා road traffic accidents. This is 1.2 million people die in the world. ලංකාවේ 3000 මරනවා, දවසකට 8000 මරනවා. So I tell that this should be studied. ඊට පස්සේ and this you can't say මට හිතෙනවා ඒව නෙමෙයි, this is all published. Then you tell what you tell no one had done because I did a literature review මුකුත් නෑ. So no one had done. Big problem. No one had done. I should do. I should do. So that finishes your introduction. Anything not there in the introduction, but things that people have done on road traffic, say injuries or deaths in Sri Lanka, should come into the literature review. Why? Because discussion එකේ දැන් කොහමද ඔයා කියන්නේ මට 350ක් ආව මේක ප්‍රශ්නයක්. චීනේ මැරෙනවා අවුරුද්දකට 50000. ලංකාවේ අවුරුද්දකට තියෙනවා ඇක්සිඩන්ට් 30000. කොයිද ප්‍රශ්නේ වැඩි? Which has the bigger problem? China or Sri Lanka? So compare things you need. No point in putting what you have put in the introduction again in the review. No? So literature review, but literature review will have things that you haven't put in the introduction. Because introduction, your main objective is to tell why you are doing this research. So this doesn't matter whether it's dengue or back pain or primary health care or hypertension or myocardial infarction. And remember, then what them say you go and eat a kanu or something, you get idea. This I have to study. Then when you look at it, it is not a problem. No one gets this disease or no problem. Then you can't do because you can't justify why this should be studied because you can't. Ituna paliyata dennek vitara moak karwen ekak you can study. Right? That is the whole basically proposal. And then the data collection and results comes from this because your methodology is your data. So methodology basically you write what type of the study we will describe. Whether it is descriptive, analytical data. Then area or place of the study. Right? For the current, I do in the National Hospital Sri Lanka and make a duration into the current. We will discuss then who are the participants of this study. Right? And then that is the participants, the number of participants will be sample size. Right? Sampling, method of sampling will be how you take these people from where. Right? Then you have Then inclusion and exclusion criteria will take from the people you take, whom you are going to not take, whom you are going to take, right? Then you have the people. Now you have to collect the data. Then how are you going to collect? One, what are your data collection tools? Questionnaire එකක් ඒක interview administered, the telephone administered, the self administered, the what? Google forms, So that is your questionnaire. Then who are going to collect? Data collected. You as the PI, or you take people to collect, or they put it into a Google form. That is basically, so data collection tool, basically who collect and how you collect. So because if you go to NHSL, you go to a clinic, you go to a ward, you have to tell how you collect. So remember, grade 1 වත් ගිය නැති small child who doesn't understand should understand your data collection. ඔයා ඔක්කොම හිතේ තියාගෙන ලියනවා. I'm going to collect. ඊට පස්සේ review එකට බලනවා මහා නරකයි. They rejected this. බලන්න මම මෙච්චර ලියගෙන because everything is in your mind, not in the paper. You understand, no, but reviewer has to understand. The reviewer understand and so you have to write. Write the whole detail. You ask the person to sit, talk to her or him, and what you do, everything in detail, methodology, proposal letter should come. Problem is, why proposals get rejected is reviewer can't understand. You can't blame the reviewer. So he has to decide, okay, this person is going to collect data this way because you have not written. So all the people who have now submitted proposals can go back and see whether all this has been written. If it is not written, next thing you can do is to go, depending on your religion, go to all the consult, palli, everything, bara venna, මේක දකින්න නැතුව මේ review මාම approve. Because otherwise this can be rejected because you haven't not written. Don't blame the review. Okay? So if you have written a very good one, no review will reject it. Because methodology එක ආවම next part is not in the proposal. The next comes with data. But any proposal, you have to give the plan of the data collection, entry and analysis. You can say, I'm going to enter the data into Excel data sheet, and then using some statistical software, I'm going to analyze the data. Then you can say univariate analysis I do first, and for depending on the findings, the multivariate data, whatever, that all depends on your objectives you will do. But that you have to tell, and then definitely you have to get ethical clearance and permission for the study. So that also you have to write in your proposal. From where you are going to get ethical clearance, you can say National Hospital, Sri Lanka or someplace, and permission from the director or whoever it is will be taken for the study. And then basically you can write a sentence or not how you are going to maintain reliability and validity of data. You know what reliability is. You know what validity is now. Reliability, how I remember is repeatability. You do, I do, anyone do, you have to get the same results. If you want to impress the audience, you can say reliability. Your precision also, better word. Validity is accuracy. It has to be true. May diagram you can show. So if you Robin Hood was very good now, you could displace continuously. You have gone to it displays. So he was very reliable and accurate. But there are some people who do this. Right? So if you want to kill a person, he has to aim not at the person but a little bit below and then right of the person, then the person will die. So when our police people take a gun and start shooting, don't run because you don't know who will die. Because they take aim and shoot someone else, so like this person. He is very reliable because he shoots the same place, but not accurate, another person will die. ඒක මොනවා මේක මම ගන්න දෙවිවල 1987 අර කොම් කට්ටිය මේක ඇවිල්ලා දුවනකොට මේ because you know the at the parliament now the police started shooting them, they stopped and went on all those roads killing පාරක් ඒක police කාර්යයේ ධන ගහලා ඒම් එක අරගෙන දුවනාට ඉන්න මගේ යාළුවෙක් තාත්තා කෙනෙක් මොකක්ද ජෙට්ටු ගන්න දුවනා තරම් ඉතිරිද. So he was very reliable but not accurate because he didn't want to shoot that. That's the difference. So මේ වගේ කෙනෙක් kind of valid the accurate but not reliable because he can't shoot the same place. And may have not either reliable or valid. But any research has to be valid and accurate. Then මේක මම වැඩි කරන්නේ මගේ කැත පේන්නේ ඒක. කැත පේන්නේ නැගිටින්නේ. Right? So that also you can write a little bit more. නැගිට්ටොත් එක පාට බය වෙන්නේ නැහැ. යාගෙන ඉන්න කෙනාට කරන් දෙන්න. So that also you can write a little for that වාක්‍යයක් දෙක. And then basically references. Right? Because your introduction and literature review will have references. Right? ඔය ටික ඔහොම ලියුවොත් no reviewer will reject. But if you are basically now the things that you have submitted, we say everyone gets accepted, but if anyone is rejected or resubmitted, now don't go and get angry with the people, but you can now find out why this was basically not accepted. Right? Any questions you can ask before we go to each of these sections. Review. And you can pull on them. So again, research gaps. Now you have idea. And you don't know whether this has been studied or not. You have to go and see what other people have done. Now we'll talk about research gaps, how to find. Yeah, it is possible, but you have to justify and say that the people who come to OPD are different to people who come to OPD in Colombo. Right? So always it might not be true, but just because someone else has done, you don't have to do. You can do, but you have to tell. Definitely people are different from Anuradhapura to Colombo. Any OPD. So definitely, but the question also, it depends. But you should make කරන්න බැරි කමක් නැහැ. But now the thing is, you found out that someone has done in Anuradhapura because you did a literature review. Okay. So, and the other thing is, you definitely sometimes will have to, you think idea I have, but when you look at it, someone has done, then you have to drop the idea, can't tell. But you can read that thesis and change the research. Okay. So, how change? So, we had a actual research, we can discuss that, but you can change also one person where data was collected, or now some people might have studied 15 to 30, you can study 31 to 60. So, but you have to tell that this is different because definitely the reviewer will say this has been done. Then you say no. Now, most of the time we submit a thesis, there is you are not there to answer. So if you have a viva and a presentation, then you are very lucky because you can answer all the questions and clear the doubts of the reviewers. If you don't have that, then you have to write everything in the proposal, answering possible questions also. Okay, so reliability usually you maintain reliability by this translating to English to Sinhala and having the same similar words. Then pre-test full pilot study you also do to basically see that everyone understand it the same way. Now, question when you ask the question, the person who answers should understand the question the same way you want the answer for. But if he answers a different question, then the whole thing is different. Therefore, one way you can do is translation, retranslation, and pirate and a pretext. And then if you are is not the person who collect the data, usually PI goes and take another 10% of the questionnaires and redo the questionnaire to see whether that person has, and you are going to get the same answers. So these you can say them. Well, take a validity set on a validity karla questionnaire finalize karna. Now, for an example, if you are using a questionnaire which was done used in UK, you have to translate culturally adapt because some things they do. The daily activities of daily living value. Then so you have to change it, the culturally change, and then validate it to get the actual answer. You got to validate that godak, check consensual validity, or validity godak. The etika karla a questionnaire accurate karna. The questions you ask, patient will understand the way you ask or you want them to understand. And that is why you can't ask questions in English because we are not English using. So Sinhala and Tamil. So you have to translate it to Sinhala, retranslate it to English and by another person, and then see whether you get the same answer. Tamil also same thing. Second thing is when you are administering a questionnaire, you can't remember and read. You have to look at the questionnaire, only read the questions and get the responses from the patient. You can't ask things that are not in the question because you might be then doing unreliable things, unreliable things from different respondents. Like more than weighing scale anyone. And remember, self-administered general population because general population their literacy and everything is different. No? So the hospital nurse doctor if your participants are of different education status or literacy, then you can't use the self-administered question. So then you have your interview-administered question. Right? Self-administered is easy, quick, but depends on the type of people you are doing. So don't get angry with reviewers for rejecting because why they are rejecting is now the thing is then your objectives are connected to your methodology. So if methodology can't achieve objectives, definitely reviewers will reject. Right? Remember. Okay. That is the whole, this is kind of a very logical sequence. And it's like you are trying to go in a huge vehicle in a road that the vehicle can't go. So same thing. This is what they take into account. And methodology has to achieve the objectives. Hospital, you are going to take a random sample of all healthcare workers, going to give a self-administered questionnaire. Definitely, reverse will say you can't do this. Then you get 10. Okay, any other questions from virtual people also? slowly now, most probably you might be thinking of what you didn't do or do in your proposals. We can, computer is somewhere.
Yeah.
Same slides.
I speak to this because. Okay. Right. No other questions. We'll go slowly to this. And this is justification, which is sometimes called justification, sometimes called introduction, background. All this is basically, we discussed briefly, is you are trying to tell why you should do this study, right? And it's basically because it's a problem, you are doing it, and the problem is either the burden is huge, or a lot of people are dying, a lot of money is spent. It's a huge problem. So basically, you justify why you are doing. And first, so the justification, you have to tell the burden or the size of the problem. Then, second thing is, you have to tell no one had done this research before. Otherwise, you don't have to do it. And then you are doing, and then basically how you are doing it will come in the methodology. In the section for justification, the researcher provides arguments to defend the need for the study. Basically, defense. You say now I must do because this is happening. But remember, each sentence you have to have a reference. So you can't write opinions, ideas that comes in the discussion. Discussion you can say. Introduction back, right? And then some of such arguments include that what is being investigated is important, critical, or topical, right? That the area being investigated has knowledge gaps that need to be filled, as he asked. And then the study intends to justify the applicability of a certain theory in a given field. This came from during COVID. A lot of this came because people started telling various things, especially the WHO, because it was a new thing. No one knew what was happening, and then various theories came. Some everyone had to do, some had to do. Then the vaccines came, and study will be of use to different stakeholders like policymakers. So basically, justification, you defend or you try to tell why you have to do this study, and then that there are problems in the area. So therefore, all these you have to give a reference because otherwise it becomes your opinion. Okay. So one thing I really want to do at the moment, which has nothing to do with family medicine subject, I really want to find out actually whether doctors are going on or not. And to analyze from say about 2015 how many doctors are there, how many doctors are there. Because to my knowledge, can be consultants have gone and a lot of people, but no one had left the service. Government gives 5 years leave. People took 5 years leave and left. Can you blame the doctors? No. Why gave 5 years leave? Then you කියලා කෑ ගන්න දුන්නා යනවා. දැන් ගන්නවා කන්සල්ටන්ට්ලා දෙන්නෙම ගියා they both put leave and gone. Actually, any government servant, employee, doctors are eligible for 5 years leave. So you can take it at any time and go anyway. And so there are problems, vacancies are there, but this is not my creation, but one research you can do if you have access to data is find out how many doctors have gone. Put a trend analysis and show that this has been happening now. Actually, there is a problem. I don't know. So, because that data is not available. Go to annual health bulletin. You can put it at Lanka. There is how many people are dying, cause of death data, hospital admission data, and for various diseases, all those data you can write a paper each because that is not a journal article. It's a government publication. But because government publication is public data, you don't have to get permission from anyone. You don't have to get ethical clearance also because it's in the public. So this is introduction, justification of background. Do you have any questions on that?
Just explain by taking another example.
ඒක දැන් මම ඊළඟට අහන්න හදන්නේ කාට හරි කැමතිද? ටොපික් එකක් තියෙනවා නම්
So now actually, you have the topic already here.
And yeah,
ඔව් ඒක තමයි. නෑ ටොපික් එක තියලා අපි ටොපික් එකකින් ජස්ටිෆිකේෂන් එකක් හදමු.
Read the topic, then the topic.
so this is the topic. Prevalence of depression, anxiety, and stress among patients with diabetes at selected primary care units in Lanka district.
Well, first, you have to tell that diabetic patients have anxiety, depression, and stress. Right? Introduction. First, you have to tell because otherwise, why should you study it? Because if it is not a problem, so you have to find a publication from Sri Lanka. It need not be Sri Lanka, right? Because diabetes is a disease which is all over the globe. Yes, there are diabetics in, let's say, UK are having this, then Sri Lanka also can have. So you can say this is a problem in diabetes. One. Yeah. So our problem is not needed too much. You will fall into trouble.
That's the way of thinking.
Because depression scale that came, stress එකක් නැහැ, anxiety එකක් නැහැ. So validating 3 questionnaires is about 3 PhDs. Because of validating, translating, validating questionnaire is a PhD. So you are doing 3 PhD. Congratulations. That's a different issue. But so too much. You learn. Okay, this is a small advice. If you are doing something for a research degree, do the minimum to get the degree. Then you can go and get Nobel Prize or something doing the rest. Because if you try to get the Nobel Prize at the degree, you might not get the Nobel Prize as well as the degree also. Again, the minimum, maximum research descriptive. Right? Find an area where no one had done. Then you can justify mage MDA was some road traffic accidents. Right? Mata okata descriptive permission then නැහැ කියලා පොඩි බයක් තියෙනවා මම cost calculation එකකුත් දැම්මා. Right? ඒ review එකක මට තාම මතකයි. Reviewer said this is a pure descriptive study. Right? But as there are no previous studies done, no data. If the board agrees, this person can do the MD. So I got to. It's a pure descriptive study, but I described this on Candy. ඒකට මම cost එකකුත් calculate කරනවා. හැබැයි then second thing is you can't do an analytical study if no one has done a descriptive study. So new area, you can't suddenly like you jumping into sea without knowing how to swim. Right? So you have to someone has to this epidemiologist, basic epidemiologist, person, place and time. ඒක කවුරුත් කියලා නැත්නම් you can go and do any case control studies of both sides.
Instead, shall I give us already give us then now? It's okay. Udan first one I will give it to you because it's easy for you.
නෑ නෑ එකම නෑ මේක යක් ඒක
Kaman
ප්‍රශ්න
na
ප්‍රශ්න
kaya
නෑ මම කිය තුන තියෙන එක යට කරදරයක් නැති. So first
Justification is not file.
නෑ යට එකක් නාලා permission ගන්න. Depression හොඳයි මොකද depression වල scale එකක් තියෙනවා.
Yeah, that's it.
සිංහල translate කරපු validate කරපු scale එකක් තියෙනවා. Anxiety මම හිතන්නේ ලංකාවේ නෑ ඒක.
Anxiety එකක් තියෙනවා but anyway for the diabetes and අපේ වෙන වෙනම කරා because you have to have like to validate signal validation එක.
ඒක නම් දෙමළ කරන්නේ නැහැ කියලා set වෙනවා.
Oh, ඒක shape වෙන්න පුළුවන් but shape
That is okay.
we narrow down to depression.
නෑ අපි මේක මම
තාම නෑ ඒක අවිලා
නෑ අපි topic එකනේ. ඒක also first you have to tell that this is a problem.
Yeah.
Right? So you have to find articles to tell depression, anxiety and stress are problems among diabetes. Right? So if you can't tell that, then you can't do the research because there is no justification. Right? So for that you can say diabetes is a huge problem in the country. There are enough publications. Then medical AI gets again there are publications. So this in diabetes will cause diabetes very then lot of other problems to the country. So that is your justification. Therefore, this study needs to be done. Second thing is, I am very sure no one had done it in Sri Lanka, so you can tell. There is no problem. No one had done it in Sri Lanka. This is a huge problem. So this must be done. Right? So your problem is solved. Therefore, I am doing this study. In the journal article, you can say with the objective work. But because there is a thesis with the following objectives. Your general objective will be topic. Right? So then what were your specific objectives?
This thing, now he added the word in primary care. So if this not, they have not done this type of phases in primary care, again it's a new one.
Oh.
They thought you can justify that.
एकदम प्राइमरी केयर ज्वेलरी කරලා නැහැ. ඩයබටිස් ගොඩක් රිසර්ච් කරලා තියෙන කටුනන්දලේ හැබැයි
They have done.
they have done හැබැයි ඔය වගේ එකක් මම හිතන්නේ නැහැ.
The problem that why you want to detect the depression among diabetes problem we have to come out specifically.
ඔව් ඒක තමයි මෙයා කියන්නේ ඒක ප්‍රශ්නයක්
කියන්නේ.
ඩයබටිස් වලට මේ තුන ප්‍රශ්නයක් හින්දා there are problems to the country the diabetes everywhere. Primary care therefore he has to do the study, that is one. Then as he asked, there is a huge research gap because no one had done in Sri Lanka. So there is enough justification, so no one can argue and say you can't do it because you have to do it. Topic එක තියෙනවා primary care එකක් දැම්ම topic එක තියෙනවා then you basically have justified that you need to do, so then we go to the objectives.
So the general objective to estimate the prevalence of, in this case, depression, anxiety, and stress in patients with type 2 diabetes and primary care level. And specific objective to compare the level of depression, anxiety, and stress among male and female type 2 diabetic patients.
General objective.
This is very in the general objective.
General එකේ මොකුත් නැහැ එහෙම එකක්. compare කරලා. ඔයා කියලා තියෙන prevalence එක විතරයි. දැන් ඔයා එකපාරට comparison එකක් කරලා ඉන්නවා. So this is the issue. So you have to link. This is a totally logical process. You can't come specific objectives which are not in just a general thing. So I'm not trying to basically discuss the research because that's not my job. The way the prevalence of the what is prevalence? What was the study different?
We can use a proportion of the.
Generally, prevalence what was it was good current.
It's a general object, it should not be.
The prevalence of the prevalence should be your specific object. So I'm going to find another specific objective. So if you are going to find out prevalence of stress now for specific objective, prevalence of stress among diabetes in primary care setting, prevalence of anxiety. Stress. Because specific objective is the variable then then what are you going to do? So specific objective because you are going to achieve specific objective. You can't humble. Some other boards can go specific objectives. That's a different issue. But because they don't specify general object. Keep it general. Because then you can break it into smaller pieces. And you can first specific object can be socio-demographic characteristics of diabetes coming up. Because you are anyway going to give the age as a specific anxiety, stress, and make in primary care diabetes. No. The prevalence the prevalence it was different.
So instead, why we cannot use the word proportion of diabetes among proportion is very more.
You're finding.
Yeah.
Don't keep the general objective general. Make the specific objective specific. General like a specific. After that, you can't go in.
Cannot do, but
Do
that's the thing. There's nothing to do.
But so methodology. You tell what you're going to do. It's what you can proportion. Because that is linked with your questioning.
Yeah.
So one thing is, you are going to get a degree. Do the most easy, cheap study to get the degree. Nobel Prize later. Well, Nobel Prize can never. What PhD to? So you get the upper 3 PhDs, you get a MBA can get up. And definitely you can write 3 very good journal articles on the stress, anxiety, and depression. Definitely. Again, you will have to go to a lot of trouble because you have to get 3 qualitative data. Tunemma questionnaires then depression anxiety stress you have to measure. You got to measure qualitative stress measure questioning. The second I don't know very much about qualitative data. I know more quantitative. You and quantitative.
Yeah, that's
It's easy. And at the end, qualitative jolly good. So what? Then the next can. Yeah, then make your stress then what is stress? So therefore, quantitative whether primary healthcare setting if I am wrong, please tell. Mama am a primary healthcare setting review article but because OPD, do you know there are no OPDs? OPD in the mail article. Ganu Pirimavat Kiyata article.
Right now, since the other ones are there for the last few years, we have already like done several like sort of research in primary care. So majority is like based on the OPDs and. the
ඔපිට
primary
ඒක
care.
තියෙනවනේ නියම.
But we have some. At the moment we have now.
නෑ තියෙනවනේ හොඳයි. මොකද මුලින් මම එකක් ලියලා ඇත්තට මේක ගියා මේ සරව ගොම්පත් සතිය එක පෙරදිනේ I put some intention but it was rejected by CMG published in an international article like rejected from CMG that may have it was published we actually did it for 1 week in OPD Peradeniya. Right? It was very interesting study because OPD එක data collect කරන්න කොච්චර අමාරුද කියලා කල්පනා යනවා. Right? It's very difficult no. හැබැයි අපේ ගෑනු දැන් ලංකාවේ do you know how many OPD patients are attending OPDs in Sri Lanka?
Now the thing is that there's a happening. The OPD ekatan, it's easy to go to that app and it gets all the details now.
නෑ ඒක නෙමෙයි ඒක කවුරුද publish කරලා නැහැ.
Publish කරලා නේ, but it's the easy
ඒක
for
තියෙනවා
anybody
නම්
can do now.
so it's start publishing because ලංකාවේ හැම මිනිහම පස්සරයක් OPD එකට ගිහින්.
Yeah, that's true.
That is the amount of OPD visits that is
It's
happening.
around 50.9% of attendance like that in.
50 million OPD admissions so they are කියලා මොකක් හරි මට මතක නෑ කොහොමද ඒ කියන්නේ ලංකාවේ population එක 20 million. So everyone had gone 2.5 times. Oh, I think everyone has not gone 2.5 times, but some people have gone more. Just imagine it, 1 rupee is the cost for a OPD visit. It's definitely more than 1 rupee. That is 50 million Sri Lankan rupees government has spent on OPD. Now remember, according to central bank data, 50% විතරයි OPD වලට රජයෙන් services supply කරනවා. 50% is out of pocket. That means we are a very sick country because each person has gone 5 times to OPD in the country, either government or private. හැබැයි ඒක කිසිම data එකක් නැහැ. ඒ කියන්නේ ගෑනුද වැඩියෙන්නේ පිළිමද කියලාවත්. Because no one had analyzed. It's a national data. දැන් IMMR එකේ OPD නෑනේ. Indomobility mobility එකේ OPD data නෑනේ. So there is no way to ministry okay. So this is the health informatics side now. So what you can do is wherever you are working, OPD එකක ඕක you can publish. Then why they are coming? Cancer, the symptoms, cancer, it was then what are the drugs given? Panadol, Piriton, and then of course 5 articles. Go to any OPD, primary care, diabetes service, because it's very important to the last thing, make it policymakers. Policymakers that it's very important because policymakers director has to give basically facilities for these OPD patients. No? So how can the toilet tap other than again the film then get a home and done? So that is basically about OPD, but it is uncanny thought of I'm very sure there is no so that is basically you think about only thing is don't make it very specific to general. So